Hi, this is Crystal, also known as Amrit. I'm coming to you from beautiful Bucerias, Mexico. I come here to have a stem cell treatment done on my left knee and my right shoulder. The knee is really what drove me to come here. I've had 4 surgeries. 2 of them were ACL reconstruction surgeries. One of them repaired my meniscus, and the other actually removed a significant amount of my meniscus. And I apologize for any background noise. But hey, I'm in Mexico. And it's fantastic. This is such a beautiful little town. So I am having my treatment done at a place called Dream Body Clinic. And I can say so far my experience has been absolutely phenomenal. I got an Airbnb just a few blocks away from the clinic. This little town is very safe, about 30 minutes north of Puerto Vallarta. And I have the treatment scheduled for tomorrow, but I wanted to go ahead and just kind of give an idea of my experience so far and what's to come. And then I'll do a follow-up after the treatment tomorrow. So the day I arrived, I pretty much had the day to myself. And the next day, I went in and had MRIs done on both my knee and my shoulder. The equipment they use, the MRI equipment, is really state-of-the-art equipment. It's not the traditional MRI machine where you lay down, they strap you down and put you in this huge container that a lot of people have issues with, people who are claustrophobic, that is. It's not like that at all. There's a little small device that they put around the body part that they are doing the MRI on, and then they slide the table to where that body part is under what looks like a very small version of the big MRI machine. So it's just the body part that actually has to go underneath the part that's doing the MRI. It took about 30 minutes for each one. The staff at Dream Body are extremely professional, very, very nice. Yesterday was my birthday, and when I got done with the MRIs, they had a little cake and some coffee waiting for me. It's just very, very nice. And I didn't even tell them. I think they just saw my paperwork and wished me a happy birthday. I've had a driver who works with the clinic. He picked me up from the airport, drove me to my Airbnb. He has picked me up every morning for my appointments and takes me back. So I haven't had to find any taxis or make travel arrangements for myself. They've taken care of all of that. The clinic is extremely clean, very nice establishment. Today I went back and I met with the doctor to go over my MRI results. She first went through my blood work. They also did a full blood panel to check everything, things that I wasn't even expecting. Glucose levels, cholesterol levels, white blood cell counts, red blood cell counts. They just want a really thorough look into that type of testing to ensure that I guess there's no indicators that that the treatment might impact you in some negative way. So when she went through each line item on the blood panel one by one and explained to me what it was and where my levels were. Then she pulled up the images for the MRI and we looked at them on the computer together, and these were by far the best images I've ever seen. I've had multiple MRIs of my knee and my shoulder. I even had one done with contrast in my shoulder. And I can say the images I looked at today are by far way better than anything that I've seen from my MRIs in the US. She sat with me and went through each image and showed me everywhere that looked really good and the places that needed help. She gave her opinion on how she thought the stem cells could help me. And with my knee, she was very candid to say that because I've had so many surgeries, it's unlikely that I will have a fully repaired knee like it was before I suffered my injury back in 2013. But she did tell me the places where she thought it will help me, and that in 8 months to a year, that's how long you can continue to see improvement after this treatment. She said she suggested having another MRI done at that point to see my progress, and then consider if maybe another treatment might give me further results. So I really appreciated that she didn't try to just sell me on something. She was being very candid on her analysis of my imaging. So I'm moving forward with the treatment. I will have 1 injection in my knee and 1 injection in my shoulder. Each of them will take anywhere between 5 and 10 minutes each, and that will be it. I should start to see results as early as 2 to 4 weeks after the injections, but she said normally it's 6 weeks to 3 months is when you really start to see improvement, and the improvements can continue up to a year. They gave me paperwork that describes thoroughly what I should and should not do immediately after, the type of physical therapy exercises I should start in 2 weeks, and then how I can progress after that and what I can and can't do. So it's been super informative. Everyone at the clinic speaks English very well, including my driver. He was even nice enough to take me by the ATM today, because it was the only one nearby is up this really large hill that I can't walk up, or I can, but it would be really painful. And so he was nice enough to even take me by the ATM machine before taking me back to my room. So they have just been so lovely and helpful. I'm excited about the treatment tomorrow, and I will certainly check back in with you once I have the treatment, let you know how that goes, and I'll continue to document my success with the treatment as days go by, and I will be completely honest to my results, because I know there are a lot of people that are interested in this type of procedure and have their hesitations with it, and rightfully so. I'm just trusting that this is a good option for me, and I want to do everything I can to avoid having a knee replacement. I turned 44 years old yesterday, and 3 orthopedic doctors in the US over the last year have all said the only thing that will help me is a knee replacement, and I'm refusing to accept that answer. I know that there are other alternatives in the world where my body, if it has what it needs, can heal itself and get better. And so, look, there's a horn for confirmation. Thank you, Spirit. All right, so until next time, bye.